Hello, everybody. I wish all are doing well and keep safe and protected. This video I'm doing, just answering some questions about uh, protection from the COVID-19, and we'll talk a little bit in details on some protective devices that you can use against the COVID-19. But before that, I would just like to remind you, if you have any questions or you need to ask about anything related to that, feel free to contact me anytime, either on my Facebook page here on the inbox, on my phone, on my WhatsApp, whatever you find it convenient. Today we are talking about first about the masks, how to wear it, the surgical mask, how to wear it in the right way. So actually the surgical mask here is made out of three layers. First, the covered here is the colored layer, which is actually is anti-droplet repellent. It repels the droplets. And the inner layer, which is the white layer, which is absorb the vapor that's coming from your mouth and nose. And in between, there is a layer which is act as a filter for the microorganisms to enter inside your respiratory system. So to wear this mask, make sure that it covers the nose, and there is a metal part here, should be in the up part, and clip it so that it can be tight as much as it can, as you can see at the moment. While you're removing the mask, you should remove it not to touch this area at all, because you will be contaminated once more. So you remove it from the back like that, never touch the outer area, the colored area, and throw it after that into the trash or into the bin. Another thing, just we need to know that wearing the mask all the day or all the time is not the right thing to do, because from that it becomes like a part of your face, and subconsciously you will touch it all the time, and it will be more as a source of infection rather than being kind of protective thing. Another thing, some people wear two masks, so it doesn't make any difference. Just make sure, there is a question always saying, is this mask really help in protecting from the viral infection? It helps, but this is not the mask that we use when we are in the front lines with the patients in so much contact. We use something like the N95, N99, N100. It just needs some training to use it, and people who have problem with respiration will suffer a little bit with breathing with this kind of masks. But still, this kind of mask, the surgical mask, is okay if you are using it just in daily life. So just another question, when we will use this mask? Usually we will use this mask if you are going to some place that have a lot of people around, that might be nearer than the 1 meter, the social distance, or they call it the physical distance now. So it's better to wear this mask. Or if you are feel a little bit sick, despite the fact we recommend that you don't go out of home if you feel sick, but if you really need to go out of home, you need to wear this mask, the surgical mask, to prevent your droplets to get everywhere and infect people. Another thing, some people use homemade masks, which is made of cloth or like from napkins or stuff like this. That will not do anything. Like, we don't recommend it at all. On the opposite, it might exaggerate the catching of the infection and stuff like this, because it doesn't have this inner layer that filter the microorganisms, or the droplet repellent layer, which is the colored layer of the mask. At the end, I remind you just to keep safe, and maybe in the next video we'll talk about other protective things we can do, because this video now it's getting into 5 minutes, and about this infection and how to use that. Thank you so much, and feel free to contact me if you have any question. See you in the next video.